As we all know, esophageal adenocarcinoma, the primary form of esophageal cancer in the United States, is a lethal cancer with exponentially increasing incidence in the past decades. Screening for Barrett's esophagus, which is the only known precursor to esophageal adenocarcinoma, followed by endoscopic surveillance and treatment, is recommended by GI Society guidelines. Sedated endoscopy is both invasive and expensive, limiting its widespread use. More recently, there have been significant advancements in the use of minimally invasive non-endoscopic tools for Barrett's detection, which address several limitations of the conventional endoscopic approach. Hi, my name is Kornpong Vantanasiri, a clinical gastroenterology fellow at the Mayo Clinic Rochester in Minnesota. On behalf of my colleagues, including my mentor, Dr. Prasad Iyer, today I'm delighted to talk about a recent review that published in the Mayo Clinic Proceedings titled Advances in Screening for Barrett's Esophagus and Esophageal Adenocarcinoma. We thought it was timely and appropriate to provide a comprehensive review of the literature about recent innovation in the non-endoscopic detection of Barrett's esophagus and esophageal adenocarcinoma. In this article, we first highlighted the rationale and challenges with current Barrett screening guidelines. Currently, as we all know, that the gold standard for Barrett screening is a careful endoscopic examination using upper endoscopy. If the endoscopy shows features suggestive of Barrett's esophagus, biopsies can be taken during the procedure to establish the diagnosis. Unfortunately, the current endoscopic approach to Barrett's esophagus screening has several limitations, including its expensive cost, challenging access given the limited number of trained endoscopists, and lastly, the potential harm of the procedure, especially when performed in patients with Barrett's esophagus without dysplasia, who have low absolute risk of Barrett's progression to cancer. Given these reasons, it is very important to look at potential alternatives, specifically minimally invasive non-endoscopic tools to help address these limitations of the conventional endoscopic approach. We then later discussed the use of swallowable cell sampling device combined with biomarkers, including cytosponge with tryphoid factor 3, EsophaCap with DNA methylation biomarkers, and EsoCheck, which are all now being acknowledged by several society guidelines as alternatives to traditional sedated endoscopies. We also explored new methods like feathered capsule and endomicroscopy, analysis of exhaled volatile organic compounds, and blood sample molecular biomarkers. In addition, our article emphasized the importance of these advancements in improving the assessment of Barrett's esophagus and esophageal adenocarcinoma risk, and also suggested strategies for reducing incidence and mortality rates associated with esophageal adenocarcinoma. Furthermore, our article also suggested the next step for this line of research, which is likely to focus on further refining and validating the new non-endoscopic screening methods for Barrett's esophagus and esophageal adenocarcinoma, including the use of risk prediction tools to individualize the patient selection process for screening. This would involve extensive clinical trials to establish the accuracy, reliability, and practicality in a clinical setting. Additionally, research might also explore the integration of these methods into existing healthcare system, evaluating their cost effectiveness and ultimately the impact on patient outcomes. With that, I would like to invite everyone to check out our review on Mayo Clinic Proceedings, and please feel free to reach out if there are any questions. Thank you very much again.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.